In late April, a doctor by the name of Lorna Breen died by suicide. Her story made headlines all around the world. Dr. Breen was a New York City emergency room director who reportedly didn't have a history of mental illness. But her death sparked conversations about mental health support for frontline workers battling the coronavirus pandemic. In both Canada and the US, 1 in 5 people experience some form of mental illness throughout their lifetime. And while there are many factors as to why someone may experience mental illness, experts are looking into the impact the coronavirus is having on frontline workers.
We are seeing healthcare professionals having to make often life-altering decisions under pressure because things are changing so fast. And these can be life-altering and they need to be done quickly a lot of the time. And so with that new kind of stress, you also see that people are just going to be a little bit more elevated than they usually would be.
For many frontline workers, the hours are long. And with physical distancing rules in place, these frontline workers are often the only people around COVID patients. Some who are dying.
I think any healthcare providers, they want to do the best job they can do. And that isn't just about skills. It's about treating the patient as a whole person, and that means their families. And we recognize that patients come to us with families and supports and all kinds of stories, a narrative about their life. And when you're just providing the care that you need to provide because you may be understaffed or it's very critical, and you don't have that patient's family there also to help, to communicate with them, to help support them through what the patient's going through, I think it feels really bad for many nurses.
Following the death of Dr. Breen, many hospitals and organizations began offering more mental health support, advice, and tips for workers. These services include counseling by phone or online, cognitive behavior therapy, or even self-care tips. Dr. Alani Verji says some other strategies leaders in hospitals and organizations can offer their frontline workers include making sure they're actually getting sleep, are eating properly, are staying hydrated, and making sure workers get time off.
These are the systemic things that can be done to make sure that healthcare professionals' mental health is being supported. There's often this feeling that when we are experiencing emotions that we don't like, the best thing to do is just push through, ignore, or try to cover it up with something else. But that usually ends up affecting us more in the long run. Whereas if we just kind of acknowledge what we're feeling and allow it to be, we end up being able to tolerate the emotion and to deal with it a lot more effectively.
Walton says there can be a culture within the healthcare sector of pushing through and dealing with your emotions later. But that's because a frontline worker's first priority is the patient they're looking after.
But over time, that takes a toll, right? And at some point, you do have to deal with the emotions, and whether it's the grieving or the emotions or the frustration, the anger, the sadness you have, these things build up. There's always a few patient cases that stay with you for whatever reason. And usually it's something you've really learned about yourself and how you need to work as a nurse or as a physician through a really difficult patient case. But those are usually few. Right now, I would say that many healthcare workers on the front line are dealing with case after case after case like this.
On top of that, the usual outlets like going to the gym or even socializing with friends aren't possible right now.
This puts a toll on our bodies, it puts a toll on our minds, it puts a toll on our emotions. And often in the process, we forget how to cope. When we used to have single stressors, we knew how to get through them. But after months and months of going through it, the things that used to work, maybe we don't do them anymore, maybe they don't work anymore. And then we're lost with no coping strategies that are going to work for us. This also increases the likelihood of substance use and unhelpful coping strategies because those are often the ones that work the fastest, not necessarily the most effectively.
A recent study of more than 1,200 healthcare professionals in China was conducted. And it showed that during the peak of the coronavirus in the country, half reported to be depressed, 45% said they had anxiety, and 34% reported insomnia.
I think for many frontline workers, it may be that people just don't really understand well what they're going through, and there may be some hesitation to share, what's going on at work with people. It's frightening, it's very real, and they haven't had time to process it themselves. So to come home and say, I'm going to talk about, my day at work right now and what's really happening and how terrified I am, they also may feel quite protective.
Thanks for watching. If you want to stay up to date on the latest breaking national and international news, be sure to subscribe to our channel, where we also dig into big issues around the world in our weekly series, Global News Explains.